Hi. Now there are various weight loss medication came to the market and they're making a lot of news. So the recently introduced injection Mounjaro has made a crores of business in single month, just 2 months after introduction to the market. And last week, the injection Wegovy is introduced to the Indian market. These are all injectable weight loss drug and convenient weekly dosing. You can take weekly one injection for 6 months, 1 year, or people are losing 5 kg, 10 kg, 15 kg like this. So, what is the difference between these weight loss drugs and older version of weight loss drugs? In the earlier days, there were weight loss drugs like Orlistat and all. They're only blocking the fat absorption, and they also have a lot of side effects. So, these weight loss drugs are convenient. It's easy to use. Now you can take it weekly once injection, and every Sunday take an injection. It will be very easy for you. And these are really addressing the root problem. For example, the new weight loss drugs like semaglutide, Ozempic or Wegovy, or tirzepatide, the injection Mounjaro, these even improve the insulin sensitivity. How? By reducing the fat loss, reducing the weight loss, it increases indirectly help in improving insulin resistance, reducing the insulin resistance and improving the insulin sensitivity. And this injection Mounjaro, like that is tirzepatide, boost adiponectin production, and it also decreases glucagon action. In many ways, it also helps to improve the insulin sensitivity. That means this is the first time the weight loss drugs, which is by improving the insulin sensitivity, are addressing the root cause of the disease. So, for all the diabetic medication, are only treating the symptoms. Diabetic medication, somehow they control the sugars, and insulin it control the sugars, but they're not addressing the root cause. This is really game changing. These weight loss drugs helps in reducing the weight, controlling the sugars, and over a period of time they're also addressing the root cause of the disease. So this is a big game changer, especially the weight loss drugs. Right now there is the oral semaglutide Rybelsus is available in Indian market, and the weekly injections like injection Mounjaro, which has a dual action, both GLP and GIP, and semaglutide, that is Wegovy, that's also weekly injection. You can take a weekly injection like insulin with like insulin injection. It's not much painful. Sometimes you can self administer also. And some of the last 3 months, I use this injection Mounjaro for many of our patients. I suggested for some patients who are chronically overweight, pre-diabetic, diabetic. Sometimes patients only ask me to start the injections. So many have a good tolerance, except that on the day of injection, they have complete nausea, vomit sensation, and some people have dizziness. And next 3 4 days, their appetite will decrease. Matlab they can't eat more. In that way, their calorie intake also will decrease. They have a 3 4 days less intake of the food, and last 2 days they don't have much symptoms. So every weekly, once you take injection, the injection Mounjaro is available in 2.5 mg strength. Usually the recommendation is to give 2.5 mg once a week for a 1 month, then increase to 5 mg, 7.5 mg, and 10 mg, and so. So in similar way, injection Wegovy is available in zero point 0.5, 0.71. Both are subcutaneous injection, and after injections, compared to a tablet form, the injections have better weight loss and better acceptability because it's easy to take. Tablet means every day you have to remember the tablet, every day you have to take. There's a chance of missing it. And taking weekly injections is very easy, and this is really improving. What in my patients, I faced many patients in the last few months. Many people have got on average 2 to 4 kg weight loss in a month. That's a good weight, but they have to complement this with a good lifestyle. They have to follow a good low carb diet with optimum proteins, and they have to walk, exercise, good sleep. All these lifestyle changes has to continue with this, because this weight loss, what happens with these drugs, it is not for lifelong. It will definitely sustain up to 1 year and all. And if you don't maintain your proper lifestyle and a diet, you may put on weight again. So, but only promising thing is This is compared to the olden weight loss drugs. They are more promising, they have a more effective, and also addressing the root cause of the problems. So, including the fatty liver, high triglycerides, overweight, diabetes, metabolic syndrome, and some of the weight loss like semaglutide also have a cardiac safety. They're good for the heart also. Like this, weight loss drugs what available in the market is more promising. So, what happens in future? In future, now the weight loss drugs are little expensive. The one injection may cost around 3 to 4 thousand per week. Your monthly cost may go up to 15 to 20K. That is not reachable for many people in India. And generic versions are maybe coming in 2026 once this patent is off. And next, there is a dual action tirzepatide Mounjaro. Next, there is a triple action. Some injection of weight loss which acts on GLP, GIP, and also glucagon. And there is also research to make the monthly injection in future. So they're all in phase clinical, but more or less, these new weight loss drugs are really the game changer in this weight loss segment. That's all for now.